Durante décadas, nos han dicho que los ataques al corazón siempre se anuncian con dolor en el pecho aplastante, colapsos dramáticos y el agarre inconfundible de una mano alrededor del corazón. But here's what medical research has uncovered that could save your life. After age 65, nearly 45% of heart attacks present with symptoms so subtle, so easily dismissed, that they're mistaken for normal aging, indigestion, or simple fatigue. Today, I'm going to share the silent warning signs that your heart may be crying out for help, signs that are often overlooked until it's too late. I'm Dr. Linda Parker, and what I'm about to tell you challenges everything you think you know about recognizing a heart attack. The truth is, your body after 60 speaks a different language when it comes to cardiac events, and understanding this language could be the difference between life and death. The reality facing seniors today is both startling and preventable. Every 34 seconds, someone in America suffers a heart attack. But here's the critical part most people don't know. Among adults over 65, silent heart attacks account for nearly half of all cardiac events. These aren't smaller or less dangerous attacks. They're full-blown myocardial infarctions that damage the heart muscle just as severely as their dramatic counterparts. But they whisper instead of scream. Why does this happen more frequently as we age? The answer lies in how our nervous system changes over time. The pain pathways that would normally send sharp, unmistakable signals to alert us of heart tissue damage become less sensitive with age. Additionally, seniors are more likely to have diabetes, which can cause nerve damage that further masks the typical chest pain we associate with heart attacks. The result is a medical emergency disguised as an ordinary day. Consider Margaret, a 72-year-old retired teacher who called her daughter to cancel their lunch plans because she felt unusually tired and slightly nauseous. She attributed it to something she ate the night before. 3 días después, el trabajo de sangre rutinario reveló enzimas cardíacas elevadas, indicando que había sufrido un ataque al corazón significativo durante esas mismas horas. She thought she had food poisoning. Ella tenía daño en el músculo cardíaco y se perdió valioso tiempo de tratamiento porque ni ella ni su familia reconocieron los sutiles signos que su cuerpo estaba enviando. The first silent symptom that seniors must never ignore is unexplained fatigue that feels different from your normal tiredness. This isn't the fatigue you feel after a busy day or poor night's sleep. It's a profound exhaustion that seems to come from nowhere, often described as feeling like you're moving through thick syrup. When the heart muscle is being damaged during a heart attack, it struggles to pump blood efficiently throughout the body. This decreased cardiac output means your organs and muscles aren't receiving the oxygen-rich blood they need, resulting in an overwhelming sense of fatigue. What makes this particularly deceptive is that many seniors already deal with various levels of fatigue due to medications, sleep disturbances, or other health conditions. However, cardiac-related fatigue has distinct characteristics. It often comes on suddenly, without an obvious trigger, and it's accompanied by a feeling that something just isn't right in your body. Unlike normal tiredness that improves with rest, this fatigue persists and may actually worsen when you try to engage in even light physical activity. The second critical warning sign is digestive distress that masquerades as a stomach problem. Durante un ataque al corazón, especialmente en mujeres y personas mayores, las señales de dolor pueden referirse al abdomen superior, causando náuseas, vómitos o una sensación de severa indigestión. The vagus nerve, which connects the heart to the digestive system, can transmit cardiac distress as gastrointestinal symptoms. This digestive distress isn't your typical upset stomach. It often presents as a burning sensation in the upper abdomen, similar to severe heartburn, but antacids provide no relief. You might experience persistent nausea that seems to come in waves, sometimes accompanied by vomiting. The key distinguishing factor is that these symptoms appear suddenly in someone who doesn't typically have digestive issues, or they're much more severe than usual digestive problems. Dr. Sarah Chen, a cardiologist at Johns Hopkins, documented a case study of Robert, a 68-year-old man who spent an entire evening taking antacids for what he thought was severe heartburn from his dinner. His wife finally convinced him to go to the emergency room when he began sweating profusely, and the antacids hadn't helped after 4 hours. An EKG reveló que estaba en medio de un ataque al corazón mayor. The burning sensation he felt was his heart muscle crying out for oxygen, not his stomach reacting to spicy food. El tercer síntoma silencioso es la falta de aliento sutil que se desarrolla sin esfuerzo obvio. When heart muscle is damaged, the heart's ability to pump blood efficiently diminishes. This means less oxygenated blood reaches your lungs and the rest of your body, causing you to feel short of breath, even during activities that normally wouldn't challenge you. This breathlessness often starts gradually and may initially be noticeable only during light activities, like walking up a few stairs or carrying groceries. However, during a silent heart attack, this shortness of breath can suddenly worsen or appear even while you're resting. You might find yourself needing to sit down frequently, or feeling like you can't catch your breath while doing simple tasks around the house. What makes this symptom particularly dangerous is that many seniors attribute increasing breathlessness to getting older, being out of shape, or other conditions like allergies or mild respiratory issues. They might think, "I'm just not as young as I used to be," when in reality, their heart is struggling to function properly. The fourth warning sign that's frequently overlooked is unusual sweating, particularly when it occurs without physical exertion or warm temperatures. Durante un ataque al corazón, la respuesta de estrés del cuerpo se activa, desencadenando la liberación de hormonas del estrés como la adrenalina. This can cause profuse sweating, often described as a cold, clammy perspiration, that's distinctly different from normal sweating. This cardiac sweating typically appears on the forehead, upper lip, and palms, but can occur all over the body. It's often accompanied by a feeling of clamminess and may persist even in cool environments. Unlike sweating from physical activity or hot weather, this perspiration doesn't correlate with your activity level or the ambient temperature. Eleanor, a 74-year-old grandmother, woke up one morning drenched in sweat despite keeping her bedroom quite cool. Ella inicialmente pensó que podría estar viniendo con algo, pero cuando el sudor continuó durante toda la mañana, junto con una vaga sensación de una is, her son insisted on taking her to the hospital. Blood tests confirmed she was experiencing a heart attack that had likely begun during the early morning hours. El quinto síntoma crítico es el dolor o malestar en áreas distintas al pecho. While we're taught to look for chest pain, heart attack pain in seniors often radiates to or originates in completely different areas of the body. This referred pain occurs because the heart shares nerve pathways with other parts of the body, so when the heart is in distress, the brain may interpretar aquellas señales como provenientes de otro lugar. Common areas where seniors experience heart attack pain include the left arm, but it can also occur in the right arm, both arms, the back between the hombros, el cuello, la mandíbula, o incluso los dientes. Some people describe a squeezing sensation in their throat or a feeling like someone is pressing firmly on their back. This pain is typically different from muscle aches or joint pain. It often has a pressing, squeezing, or burning quality, rather than the sharp, stabbing pain you might associate with pulled muscles. The pain may come and go in waves, or it may be constant, but mild enough that it's dismissed as a strain or sleeping in an awkward position. Dr. Michael Rodriguez, an emergency physician with over 2 decades of experience, recalls treating a 69-year-old woman who came to the emergency department convinced she had a severe toothache. Ella había pasado 2 días tomando analgésicos de venta libre e incluso llamó a su dentista para una cita de emergencia. When the dental examination revealed no problems with her teeth, her dentist, suspecting something more serious, sent her immediately to the hospital. An EKG mostró que estaba teniendo un ataque cardíaco activo, y el dolor en la mandíbula que experimentó era realmente dolor referido de su corazón. The sixth silent symptom is a sudden onset of dizziness or lightheadedness that seems to come from nowhere. When the heart isn't pumping effectively during a heart attack, blood pressure can drop, reducing blood flow to the brain. This can cause feelings of dizziness, lightheadedness, or even brief episodes of feeling like you might faint. This cardiac-related dizziness is different from the occasional lightheadedness you might experience when standing up too quickly or skipping a meal. It tends to be more persistent and may be accompanied by a feeling of weakness or unsteadiness. You might feel like the room is spinning slightly, or that you're not quite steady on your feet, even when sitting down. What makes this particularly concerning is that dizziness can lead to falls, which pose serious risks for seniors. Many people experiencing this symptom sit down and wait for it to pass, attributing it to changes in blood pressure medication or simply getting older, when they should be seeking immediate medical attention. The seventh warning sign that demands attention is an overwhelming sense of anxiety or impending doom that appears suddenly and without explanation. The heart is richly supplied with nerves, and when heart muscle is being damaged, these nerves can send signals that the brain interprets as extreme ansiedad o un sentimiento de que algo terrible está a punto de suceder. This isn't the normal worry about daily concerns or even anxiety about health issues. It's a profound, unexplainable feeling that something is seriously wrong, often accompanied by restlessness and an inability to get comfortable. People experiencing this describe feeling like they need to pace or move around, despite also feeling weak or tired. Dr. Jennifer Walsh, a geriatric cardiologist, emphasizes that this sense of impending doom is actually one of the most reliable indicators of a cardiac event, even though it's often dismissed as anxiety or stress. When a patient tells me they have an unexplainable feeling that something terrible is happening to their body, especially when combined with any other subtle symptoms, I take it very seriously, she explains. El octavo síntoma crítico es el dolor de espalda superior inusual, particularmente entre las escápulas. The heart shares nerve pathways with the thoracic spine, so when heart muscle is damaged, pain signals can be referred to the upper back region. This back pain, during a heart attack, has distinct characteristics that differentiate it from typical muscle strain or arthritis pain. The pain is often described as a deep, aching sensation or a feeling of pressure between the shoulder blades. It may feel like someone is pressing firmly on your back or like there's a tight band around your chest extending to your back. Unlike mechanical back pain from lifting or twisting, this discomfort doesn't change with position and isn't relieved by stretching or changing how you sit or stand. Many seniors dismiss this symptom because back pain is so common in their age group. They might think they slept wrong, sat in an uncomfortable chair, or lifted something incorrectly. However, when upper back pain appears suddenly in someone who doesn't typically have back problems, or when it's more severe than usual back discomfort, it should raise immediate concern. The ninth silent symptom that often goes unrecognized is unusual weakness, particularly in the arms. During a heart attack, reduced cardiac output means less oxygenated blood reaches your muscles, causing sudden weakness that's disproportionate to your activity level. This weakness often affects the arms first and may be more pronounced on the left side, though it can occur in both arms. This isn't the gradual weakness that might develop from lack of exercise or the normal changes of aging. It's a sudden inability to perform tasks that were previously easy, like lifting a coffee cup, opening a jar, or carrying a small bag. You might notice that your arms feel heavy or that you can't maintain your grip on objects as well as usual. The weakness may fluctuate, coming in waves that correspond with the heart's struggle to pump blood effectively. This can make it easy to dismiss, especially if it improves temporarily, leading people to think they just overexerted themselves or need more rest. The 10th and perhaps most important silent symptom to recognize is a combination of mild symptoms that individually might seem insignificant, but juntos pintan un cuadro de angustia cardíaca. It's rare for a silent heart attack to present with just one subtle symptom. More commonly, people experience 2 or 3 mild symptoms simultaneously. Por ejemplo, puedes sentirte ligeramente más cansado que de costumbre, mientras también experimentas un leve mareo y un vago malestar en tu brazo izquierdo. Individually, each symptom might be easily explained away, but their combination should trigger immediate concern. The key is recognizing when multiple minor symptoms appear together, especially if they're different from how you usually feel. Understanding why these symptoms are so easily missed requires recognizing the unique challenges seniors face in identifying cardiac events. Age-related changes in pain perception mean that the sharp, dramatic chest pain depicted in movies simply may not occur. Additionally, many seniors take multiple medications that can mask symptoms or have other health conditions that produce similar discomfort. The presence of diabetes significantly increases the risk of silent heart attacks because high blood sugar levels can damage nerves over time, including those that carry pain signals from the heart. This condition, called diabetic neuropathy, means that up to 60% of diabetic seniors may not experience typical chest pain during a heart attack. Cognitive changes that sometimes accompany aging can also make it more difficult to recognize and articulate symptoms. A person might feel that something is wrong, but struggle to identify exactly what feels different or how to communicate their concerns effectively. What makes these silent symptoms particularly dangerous is that every minute counts during a heart attack. The longer heart muscle goes without adequate blood flow, the more permanent damage occurs. Treatments like clot-busting medications and emergency angioplasty are most effective when administered within the first few hours of symptom onset. The concept of time is muscle in cardiology means that the sooner treatment begins, the more heart muscle can be saved. When symptoms are subtle and treatment is delayed, more heart muscle dies, leading to a weaker heart and increased risk of future complications like heart failure. Recent research from the American Heart Association reveals that seniors who experience silent heart attacks have a 35% higher risk of death within the following year compared to those whose heart attacks were quickly identified and treated. This startling statistic underscores the critical importance of recognizing these subtle warning signs. The good news is that awareness can dramatically improve outcomes. Studies show that when seniors and their families are educated about silent heart attack symptoms, the time from symptom onset to seeking medical care decreases by an average of 90 minutes. In cardiac care, those 90 minutes can mean the difference between a full recovery and permanent heart damage. If you're experiencing any combination of these symptoms, especially if they're unusual for you or more severe than normal, don't wait to see if they improve. Call emergency services immediately. Emergency room physicians are trained to quickly evaluate these subtle symptoms and can perform tests like EKGs and blood work to determine if a heart attack is occurring. Remember, it's always better to err on the side of caution when it comes to potential cardiac symptoms. Emergency departments see many patients who are concerned about possible heart attacks, and medical professionals would much rather evaluate symptoms that turn out to be something minor than miss a heart attack that could have been treated effectively. Trust your instincts. Si algo siente significativamente diferente en su cuerpo, especialmente si está experimentando múltiples síntomas sutiles simultáneamente, busque atención médica inmediata. Your heart might be trying to tell you something crucial, and recognizing its quieter language could save your life. The most important message I can leave you with is this: your heart's cry for help after 60 may be a whisper rather than a scream, but it's no less urgent. By understanding these silent symptoms, you're not just protecting yourself, you're empowering yourself with knowledge that could prevent irreversible heart damage and save your life. Take a moment to share this information with your loved ones, because awareness is the first line of defense against silent heart attacks. Your heart has been faithfully serving you for decades, and now it's time to listen carefully to what it's trying to tell you.